Hello everyone. I am Bhataraskoon. I am a professor at the Faculty of Nursing, Chiang Mai University. It is my honor to be here, and thanks committee very much for having me here and invite me to talk about the evidence-based knowledge synthesis and translation in Thailand. This is the topic that I will cover today. I will take a chance to introduce you about us, the Thailand Center for Evidence-Based Healthcare a little bit, and then I will go over the evidence-based situation among Thai nurses, and also the evidence-based synthesis, translation, and implementation in Thailand, and the challenges that we have, and the strategy to promote the evidence-based nursing practice in education and healthcare organization. The Thailand Center for Evidence-Based Healthcare is a JBI Center of Excellence. We established in 2002, and it is located at the Faculty of Nursing, Chiang Mai University. It is at the northern region of Thailand. The Thailand Center for Evidence-Based Healthcare is the oldest collaborating center of JBI among the Asia region. And our vision mission is to promote the evidence-based practice across the country and beyond. So this picture is the 8th biennial JBI International Colloquium in the year of 2012. It is a very successful colloquium at that time because we got the participant around 800, and they came from 36 countries. So in the picture, you can see Professor Alan Pearson, who is the founder of JBI, and he was the executive director at that time. And you can see Professor Craig, Ed, and all JBI staff here. And also Professor Mu, she stay close to Dr. Virawan, who was the director of the JBI Thailand Center at that time, and myself. And last year, the Thailand Center for Evidence-Based Healthcare just celebrated to be partnering with the JBI for 20 years. And today, this year is become 21 years that we are happy and proudly working with JBI. And we hope to host the colloquium in the future very soon. And next, I would like to talk about the professional nurses in Thailand to ground you the information a little bit about us. So the Thai professional nurses, right now we have about the 242,000, and that number make up over the 70% of the healthcare personnel in Thailand. We are the biggest group in the healthcare team, and more than 70% of Thai nurses graduate with the bachelor degree in nursing, and the left they hold the master and PhD. And Thai professional nurses play a crucial role in providing primary care, nursing care in the hospital, and nurse midwifery care for both sick and well population. And we use Thai language as a first language, of course, and the English is commonly used as a second language among the Thai nurses when we need to talk in the technical term. And nursing knowledge and skills are acquired through various means, including education. So we have more than 100 institutes, the Faculty of Nursing across the country to produce nurses, professional nurses. And we also have the short training to continuing develop them to maintain the skill and competency by the Thai Nursing and Midwifery Council. And they also learn through their experience and their information seeking behavior when they encounter with the clinical problem. So they need to utilize the data and information that they obtain to enhance their nursing practice. And through their information seeking behaviors, nurses need to interpret, transform, and develop the data and information to improve their nursing knowledge and skills and enables the implementation of evidence-based practice in patient care. And to prepare nurses in Thailand to adopt evidence-based practice into the nursing practice and into the nursing education. First of all, it is necessary to understand the information needs and uses, which I will walk you through about this. When we try to do the scoping review, and we found that in 2008, a cross-sectional survey of the bachelor degree nurses at the public hospital throughout Thailand revealed that Thai nurses get information mostly from their colleagues or doctors and the printed or electronic information sources more than another source. And they rarely use library, and they did not read the research and did not use research databases. The reason for not using research is because there is no time to use that, and there is an availability of the research databases, and the research itself is really very difficult to understand. So I don't think this is different from other nurses around the world. When we are looking at the integrative review from Thurs and her colleagues in 2016, they also report that the majority of nurses never use research finding to inform their practice, never search electronic database such as CNOW, Medline, or Cochrane, although they have had access to them. They'll be able to access them, but they don't search electronic database. And they rated the research finding from RCT and other quantitative research as the least important sources of information. So this concerns you a lot, right? So that means that Thai nurse or the nurse all over the world, we don't use the research very much in the point of care. When we survey of using the evidence-based practice among the Thai APN, so in 2008 is about the bachelor degree nurses. So this one Thai APNs mean that they hold a master degree at least. And then we use the evidence-based practice questionnaire to survey across the country. And then what we found, so from the questionnaire, they consisted of the attitude, practice, and knowledge and skill toward the EBP. So you can see from the table here that they have a very good attitude. This is a high score here, average score here, and following with the practice. So which means that they can do the EBP in the clinical setting, and then we found that the more they have experience, the oldest nurses is, the age and the experience of working is the predictor of the EBP using. And you can see the lowest mean score here related to the knowledge and skills associated with the EBP. And when we look at the item which below the average score in the practice of the EBP, so this is the item that they score very low is about how often have you critically appraised against set criteria. Any literature you have discovered. So this is the lowest one. And you will see why they don't do that oftenly. That is, this is the knowledge and skills associated with the EBP. So they rate the knowledge and skill in terms of the research skills very low, and information and technology skills. And this one is really important. Transform required data into the research question. So they don't know how to transform the required data, the data that they need to have, into the research question, which leading to it's really hard for them to find the research article that answer their question or their information need that they want. And here they rate the competency in finding the practice gap in their professional framework. And the last one is the answer for, the one that they said they don't frequently use the evidence-based or the research because they rate the competency in evaluating the evidence-based according to the set criteria, which means that they don't know how to evaluate the quality of the evidence against the set criteria before using them in the point of care. This is congruent with the practice of the EBP because they rate this item when we ask about how often have they critically appraised any literature that they discover. So they don't know how to rate before using it in the clinical setting. This reflects the lack of the using evidence to inform decision making at the point of care due to many limitations. Maybe they don't have the knowledge, or few of them have the knowledge about EBP, but they don't use it in their clinical practice. So some of them have the wasted efforts, which means that they try to do it without the knowledge. Some of them may produce the wasted resources, which means that they have the knowledge about EBP, but they don't use it in clinical setting. To prevent that, how to solve that problem? So this is what our center try to solve the problem. So we try to provide outreach education for Thai nurses and also the member of the healthcare team across the country. And we also have the training how to evaluate the research through the CSRTP course, the Comprehensive Systematic Review Training course. And we also mentoring them and also partnering them. Okay, so in our center, we have 12 JBI global trainers and 2 the license for the trainer of evidence implementation, and 3 can do the workshop and train people how to develop the guideline and how to implement the guidelines in their clinical setting. So our goal is that we try to establish and try to help them to use the evidence-based practice in the clinical setting, like living with the EBP. In any clinical setting, they need to have the EBP concept in their mind and try to use it. And for the outreach education, we have the systematic review training 3 times a year across the country and beyond. I use beyond, which means that we also have the English version for the countries surrounding us or the networking country that we work with. For example, in Japan um, and Philippines and some other country, Saudi Arabia, something like that. And we also have the EBP webinar. This is for the nurses across the country. You can see that 3 of them are the nurses. This is our nurse uniform that we still wear hat. And this one we talk about how to solve the problem, um, the barrier and challenges, to use the evidence-based practice in the clinical setting. And this one produce, we do the guideline development workshop, and we do that across the country as well. And we are going to do the evidence implementation training this year because that is what the participants from the systematic review training want to do, and they give the feedback that they really want to move forward to the evidence implementation. So that is a good sign. Okay. Um, and for the partnership, what we try to do, so we partner with the CMU hospital as our affiliate clinical setting. And beside that, we also partner with the hospital, the specialty hospital, the tertiary care level. So this one is we work with them to develop the clinical nursing practice guideline to um, take care of the patient who have the aggressive behavior, patient who have the psychotic symptom uh, among the amphetamine patient. And we also write the book, the co-author of the EBP book for the with the Chulalongkorn Hospital, and it is like the step how to do develop the EBP project or the intervention, nursing intervention, something like that. And also we try to initiate the curriculum that integrate the EBP into the nursing curriculum. At the work at the CMU that I work at the Faculty of Nursing, Chiang Mai University, we integrate the EBP concept into for the into the curriculum for the undergraduate level. We integrate into the practicum course. So all the courses that the nursing student need to find the EBP and use them for their nursing care in across the area. And for the graduate level, in the master degree level, so the EBP is one of the core courses for them to learn the step of the systematic review and the evidence implementation. And for the PhD level, so the EBP course is the one of the selective courses for them to choose. And we hope that by integrated the EBP in the curriculum, when they graduate, they are going to use it, and then we follow up. After they graduate from us, we also have the training and the short course training, and also from the Thai Nursing and Midwifery Council, they also provide the CNEU, the score for the nurse when they need to re-licensing. So they need to collect the score for 50 score over the 5 years, and they allow um, the institute, the nursing institute, to create or develop the EBP education short course and ask for the score for the nurse participants across the country. That is try to promote people, and then reward them, if they come for training, they also have the CNEU score. So if we look through the published evidence about the evidence-based nursing in Thailand, so this is our prelim result of the scoping review. We conduct a comprehensive search of the published and gray literature, and we identify 55 relevant studies conducted between 2013 and 2023. So this is only in Thailand. And then we found 34 studies were the systematic review reports. This is very good. And 21 studies were evidence translation and implementation report. And you can see from the graph here that the number is scattering, and you can see in the 2022, we got the highest number here, 7 systematic review, maybe because of the COVID-19 pandemic. So people try to do the research on the research more. And then we got, the type of the systematic review. We got the quantitative type, we got the qualitative, and also, the effectiveness type of systematic review. And also, we still get the protocol in 2021 and 2023. And we also have the mixed method, the systematic review in 2021, and also 2016 and 2013. And by the approach of the 34 systematic review, over 75 utilize the GBI evidence synthesis approach. Thank you. Maybe few of them, maybe the participants from our training. We hope so. And the remaining study employ tools such as CASPI, JADA scale, and Robin-Swan to assess the quality of included study. And you can see that since 2013, so we have all kind of the systematic review, and then yeah, you can see the number within 10 years. And for the nursing translation and implementation, so we also look at that and divided into 2 types, and then we found the project we can divide it into 4 types. So the first one is the EBP project, when they try to do the systematic review and try to use the result to develop the intervention and implement that, and then we call EBP project. And also they try to adopt other EBP intervention from other country and try to modify that to suit for the Thai context and use it in Thailand. And the third one, when they try to adapt the CPG from others country and other area and adapt it and implement that. And the last one, the new one, when they try to develop the new CPG and implement it in their clinical setting. So you can see that we got the number scattering here. So EBP project is the champion here. So all EBP project, and then implementation as well, and a few of the CPG development. Okay, and out of 21 study that we found, 62% were EBP project, and following by the EBP implementation and the implementation of clinical practice guideline, and also the development of clinical practice guideline and implemented. And when we look at the framework or the approach that they have for the evidence implementation, we found that 10% use JBI PESES, 10% use Delphi, 30% use PICO, and 20% use Iowa model, and 10% use 7-step EBP, and 20 for other approach. Looking at the context, so mostly they conduct the evidence implementation in the hospital for 71%, and in the community for 14%, and in both hospital and community for 5%, and not identified for 10%. So we also looking for the area specialty that they use the EBP project or implementation. So the top three are the psychiatric nursing area, and medical nursing, and emergency nursing. So like got only three reports from that area, and the other scattering from the neonatal nursing, critical care, rehabilitation, perioperative, pediatric nursing, oncology, obstetric, infectious control, geriatric nursing, community health nursing. And this is what we got from our scoping review. And when we look through the content for each one, so we can conclude that number of studies they demonstrate the evidence-based practice is essential for nursing practice in Thailand and produce the benefit for both nursing and patients. Because the implementation of the EBP project can enhance the quality of care provided to the patients, and it is also increase the nursing knowledge and skill. So this is the example of the evidence that we found, and we draw from this to the conclusion. So the qualitative study was conducted to explore the perspective of the Thai healthcare provider and from the nursing student on the feasibility of evidence-based, application-based safety planning decision aid for abused women in Northeast Thailand. So the result of the study showed that the intervention were appropriate for the Thai context and also align with the Thai government policy and resources, and had the potential to assist the abuse survivors. And another study implemented transitional care developed from the EBP for the elderly people during the transition from hospital to home. So the result also showed a positive outcome that can enhance the quality of transitional care that provide to the population and led to the improvement in healthcare professional knowledge. And this is, we also look at the implementation. When look at the EBP implementation, that, of course, that improve the patient outcome, and also for the process outcome that make the nurse have the high satisfaction. This is an example of the patient outcome that we have. So the survey study when they try to investigate the effectiveness of the evidence-based guideline for management of surgical smoke and bioaerosols among OR nurses in Thailand. So when they're implementing the evidence-based guideline, after that, it can minimize the exposure to surgical smoke and reduce unnecessary health risks for both healthcare personnel and the patient. And this one also, they try to carry out the evidence-based care bundle for people in the ER for patients with severe traumatic brain injury in southern Thailand. They found that it can improve the clinical care of the patient and by using the care bundle. And this is the pilot test to test the feasibility of the modified intervention. They modify HAZMAP T for HIV and AIDS self-management education program. So they adapt from other country and use it in Thailand for MSM population. And then they found that it is feasible and acceptable for HIV positive Thai MSM. And then for the clinical outcome, it can increase all aspects of the HIV cell management and improve the quality of life in the psychological domain among the intervention group participants. And another quasi-experimental study, when they try to compare the VAP rate in the neurosurgical critical care unit or NCCU in the Chiang Mai Hospital or CMU Hospital, when they try to develop the Suan Dok model by using the evidence-based concept. And then after using that, the incident rates of the VAP is decreased, and also the tendency of the decreasing of the number of the intubations and ventilators there is decreased, the length of stay and also the medication and the cost of care is also decreased. So that is just the example for you to see the evidence that the important and the benefit of using the EBP in nursing practice in Thailand. However, we still have the challenges, even we try to use it. And we try to compare the challenges from the Thailand to the worldwide from the literature. So from the worldwide, this is challenges of nursing evidence-based practice. So the nurse report that this is the challenge for them of using the EBP in their practice. Some of them report that because of the lack of the knowledge and skill. So this is the same in Thailand when I present to you earlier, right? And this one also inadequate time to search for the research report. I think this also found in Thailand as well. And also the difficulty in understanding research report also found in Thai nurse and limited resources and support. So this is also found especially in the outreach area hospital when they don't have the IT and internet support. So it's hard for them to find the electronic database and all the information that they need. And this one, insufficient financial, material and human resource, and also inadequate training in research method and lack of authority or power to change care procedure. So this one is very interesting, which means that we need to create the champion, create the leader who have authority, right? And then also the research finding or evidence-based practice that not applicable, not congruent to their population or to their context. So this is from the worldwide challenge that we found in nursing evidence-based practice. Look at in Thailand, what we found that Thailand also found, the challenges here, and then we move to the advanced step, try to look at the predictive factors of using the EBP. So we divided into personal factor and organizational factors. So we found that the years of experience, the personal innovativeness, and perceived barrier and perceived characteristic of the guideline. Those are the predictors of implementation of event-based practice. Okay, so in my study, the one that I try to look to survey the EBP in APN, we also found that the years of experience is the predictive factor. The more year experience, the more age of the nurses, the more of using the EBP concept in their clinical practice. And also for the organizational level, we also found that the size of the hospital is also the predictive factor for EBP using, and the organizational climate. So to have the EBP, climate or a culture, that is the most important thing that the nurse report that, and then it is the predictive factor for the EBP using. And also in Thailand, they also report the lack of the EBP support system and the leader. And right now, we are trying to look at the organizational climate related to EBP, and also the mentoring and also the mentors. And then next year, I think that we are going to have that the result. But from what we have right now is also indicate that they need the support, in terms of in the organizational level. So we also found the evidence practice gaps, which mean that the nursing care, the difference between what is known from the research or the best practice and what is actually being done in the clinical practice. Okay, it's not congruent, it's not go together. And generally, we know that it take about like 15 years, right, from the research finding into the clinical setting. Before it's 17 years. Right now, it's shortened into 15 years, but in Thailand, we also have this gap. So this is the example of the lack of the gap. I mean the lack of the incongruent, okay, the practice gap between the research finding and the clinical practice. So the recent nursing study tried to investigate the knowledge of Thai nurses regarding the neuroprotective nursing care for patients with traumatic brain injury. And we found that Thai nurses had limited knowledge in certain area. And then they suggest that it can be improved through the educational training and through the implementation of evidence-based practice, because they're saying that by doing this, the process will enhance their learning and new knowledge and new skill when they use the evidence-based practice model. Okay, and also it produces the clinical outcome that is enhance the safety and quality of care for their population, for their patient. And this is the strategy to promote the evidence-based nursing practice in the nursing education. So we think that the curriculum should prioritize evidence-based nursing care, okay, for best practice. And this is from the CNERN meeting. The CNERN is the Southeast Asia Nursing Education and Research Network. And I think we have, maybe from 10 countries. And then we have the meeting, and we try to gathering the leader, the nursing leader, across the Asian region to have a meeting and try to set up the standard for the members. And the report highlighted the need for the standardized of the nursing education across the region and regulation and the licensing to reach international standard to promote the global mobility of the registered nurse, among the membership. Okay. And they also identify that the evidence-based practice is one of the proposed clinical competency. Okay, and then they suggest that it should be included in the nursing education among the members of the country of the CNERN region, Southeast and East Asia region. And yeah, and then actually, yes, from the report, actually in Chiang Mai University Faculty of Nursing, we also have that, like I present to you before. So we integrate the EBP concept in the all level of nursing education. And I also found in another Faculty of Nursing across the Thailand, they also integrate the EBP into their curriculum. And for the healthcare organization, so what they call for is that the hospital and the unit should provide information sources and supplies to meet the information need for them, okay? Which is, the provision of information, should be based on the nursing care activities and promote the evidence-based practice. And they need to have the information source, like in the study in 2008, they identified that they need printed format because they don't have time to search by themselves. So, which means that the organization, the hospital or the unit need to provide, facilitate, the sources for them at hand. And then they also call for the time for working shift that they can use the information sources, and also the training how to search, or how to use the electronic information. So that's what they call for, and that's what they suggest. And also the nursing accreditation system should include the incorporation of the evidence-based practice as a standard of nursing care. Luckily, the Thailand Nursing and Midwifery Council, right now, the EBP is one of the competency that we identify. So that's why for the short course, we also, for the continuous professional continuous improvement, we also have the EBP as a short course for them for the continuing education. And also, from the WHO, from the last, from 2016 to 2020, the WHO recommended that healthcare professionals should base their practice on the best available evidence to ensure safe, effective, and high quality care for patients. Even right now, they move to the nursing task force, because they call for the investment in the nursing education, because we have the shortage of nurses around the world. But from this era, Thai Nursing and Midwifery Council, we implement that strategic direction. Even now, we move forward to the investment in nursing education, but we also integrate the EBP concept into the nursing practice. Okay. So I will come to the conclusion. In summary, Evidence-based practice has emerged as a crucial element of nursing practice in education in Thailand. And over the past decade, the evidence base has been introduced into nursing practice in Thailand and has proven to deliver quality care and has yield benefits for patients and also to the healthcare providers. And several studies have demonstrated that implementation of EBP can enhance better patient outcomes and increase nursing knowledge and skills and improve the overall quality of care. And however, we still have the challenges and factors that impede the widespread adoption of the evidence-based practice in nursing care in Thailand, and we need to work continuously. And we don't give up to promote the evidence-based practice among nurses in Thailand, and also, integrate that in the nursing education, in the regular program and the short course program. And for the healthcare organization, they should provide nurses with the necessary resources and supplies to meet their information needs and allocate sufficient time to utilize the resources for nurses. And incorporating evidence-based practice into nursing accreditation system is also essential to making it a standard of nursing care, which is now we have that. And lastly, healthcare professionals should base their practice on the best available evidence to ensure safe, effective, and high quality care for patients. And from the evidence, I'm sure that now we're moving forward to have to achieve the goal, try to embed the EBP concept in the hospital across Thailand. I would like to end my presentation with this picture and the quotation here. We might go fast when we go alone, but if we go together, it will enhance the sense of belonging, leading to the engagement and the sustainability. So this is why our center try to partnership with the clinical setting, try to be them mentoring, and try to engage them in the practice, engage them in the development, in the process of the EBP development, because to enhance their sense of belonging and leading to the sustainability of the EBP in the clinical setting. Okay, that is my presentation today, and I would like to stop and welcome for the question or the discussion. Thank you for your attention.